Hello and welcome to the DoctorPad podcast. I'm your host, Tanishka. This series is designed to connect patients across the world with leading doctors from India who are transforming global healthcare. Today, we are joined by one of India's most respected senior cancer surgeons, Dr. Rajesh Kumar Jain. Dr. Jain has more than 26 years of experience in surgical oncology. He leads multiple cancer programs at BLK-Max Super Speciality Hospital in Delhi, including head and neck cancer, breast cancer, lung cancer, gynecological cancers, urological cancer, gastrointestinal cancer, pediatric cancers, sarcoma, bone tumors, and robotic cancer surgery. He has played a major role in establishing cancer departments in some of the top hospitals in India and is known for his precision in surgery and his compassionate approach towards patients. This conversation is especially important for our listeners in Ethiopia and across Africa who may be looking for safe, advanced, and affordable cancer treatment options outside their home country. Dr. Jain, to begin with, I would like to understand how the cancer landscape has changed over the years, in past 10 to 15 years. Like what major shift have you observed in these years?
See, in last 10 years or 15 years, there is a paradigm shift in the cancer in terms of its incidence, its prevalence, its treatment, its diagnosis. There
Hmm.
is a paradigm shift.
Hmm.
As the world is evolving, from many countries were developing, now becoming developed, the lifestyle is changing. As the lifestyle is changing, the people dietary habits is changing. They are more of practical people rather than homely people like villagers.
Hmm.
So they are more prone to cancer now. Ladies are marrying late. They are not having children. If they have children, they don't breastfeed them. So there are issues with the personal life as well, and there is increasing pollution all over the world. So more and more use of chemicals and fertilizers in agriculture. There are a lot of things, especially in developing countries like African countries or many Asian countries. So as we see, the world is going towards more development, but practically we are not developing. Our
Hmm.
lifestyle has become more pro-cancerous. So we have seen quite a rise in number of cancer cases all over the world over the years. And last 10 to 15 years, there is definitely a change in equipments, change in treatment planning, change in treatments. More and more new modalities of treatment has come up.
Hmm.
But yes, the cancer number is increasing. That's a difficult thing to understand. But yes, more and more good and good treatments are coming. Better and better treatments are coming. But uh, at the same time, number of cases are also increasing.
Okay. So, in many different regions, developing regions, including Ethiopia, cancer is often diagnosed at late stages, even in India. So, from your experience, why does this delay happen?
Look, there are two aspects of this question. Uh, Number one is there is lack of awareness about the cancer because people don't understand why cancer occurs and how they cannot diagnose it early. In developing countries like America or Europe, there are screening guidelines and screening rules are there. So most of the patients or the most of the general public undergo yearly screening tests for cancer. So by doing yearly screening, they diagnose cancer early or precancerous conditions. But in developing countries like Ethiopia or maybe India, there are no such mass screening is taking place. So people ignore early symptoms, they don't go for screening. There are social, economical uh, barriers which don't allow them to go for cancer screening. So that is the actual reason that when the symptoms are much and the cancer attains a third stage or maybe fourth stage, they are diagnosed. Early symptoms generally our people ignore.
Okay. So, what symptoms are there? Like, what are the common symptoms which is one should never ignore?
That depends on the what type of cancer we are talking about. Say I'm giving some examples of common symptoms for common cancers. Say
Hmm.
for a lady who is having lump in the breast. So lump in the breast is a very big symptom for breast cancer, but most of the breast cancer lumps are painless. So people think that it is a painless lump, it is not creating much trouble, so they don't go to doctor, they don't
Mhm.
get it diagnosed. Similarly, postmenopausal bleeding in ladies, they just ignore it. There is a very important symptom of cancer. Unexplained weight loss, unexplained loss of appetite, unexplained bleeding from rectum, and there are certain situations where there are some like skin uh, like lesions, like black marks in the skin, which are generally there in most of the people. But when the skin mole, as we call it, increases in size, or it starts itching, or starts bleeding, probably it is converting into skin cancer. So these are the certain symptoms which people should not ignore, should go to their doctors as early as possible to diagnose whether they have cancer or not.
So, what symptoms should never be ignored?
As I told you, a, a lump, especially painless lump in lady at any age, must be investigated. Postmenopausal bleeding must be investigated. Any bleeding, abnormal bleeding from anywhere, be it from a mouth, be it from rectum, be it from with vomiting, or be it with cough, should not be like ignored. And very important is unexplained loss of weight, unexplained loss of appetite, unexplained fever not diagnosed by routine tests. So these are the things which should never be ignored, should be investigated thoroughly.
Okay. And how much difference does early detection make in terms of treatment, success, and survival rates?
Yeah, there is a huge difference. See, if you diagnose it early, then your treatment is of short duration, relatively better and more acceptable treatment. Cost
Mm.
of the treatment is less and survival is more. I'm giving example of breast cancer. Say if you can diagnose the breast cancer in stage 1, that chances of cure are around 96, 97, 98%, and the treatment may be done by a small surgery, may not require any other adjuvant treatment many a times. But if at the same time, if you diagnose it at a later stage, say stage 4 or stage 3, the cure rate may be from 80 to the cure rate may be somewhere around 40% or 30%. So the diagnosis is late, the treatment is more. You need all modalities of treatment, expenses are more, it takes more time to treat, and the chances of survival are less. So the
Mm.
crux of the matter is that it should be diagnosed at the earliest stage.
Okay. So, we see a very growing number of African patients choosing India for cancer treatment. What are the main reasons you think behind is this trend?
Uh, India is gradually becoming a global hub for medical tourism. As far as cancer is concerned, India has a good number of cancer hospitals. They are well equipped hospitals. See, main part as far as treatment of cancer is concerned is human resource. And the Indian doctors are well trained to treat cancer. There are specialized and super specialized degrees available in Indian universities. Doctors are there, equipments are there, hospitals are there, and cost is less. If you compare with European country or American country for that matter, treatment of cancer is maybe one third or half of what you spend in other countries.
Mm.
And the most important part, again, I must say, is the time. When patient comes from, say, African countries to us, they don't waste time. Immediately they are investigated, within a day or 2 or 3 they are getting their treatment done. So waiting time is less, specialties are there, specialists are there, all the modalities of investigations are available, and the great Indian hospitality is always there.
How does the cost of high quality cancer care in India compare with the treatment in Western countries?
The treatment of cancer in big Indian hospital like our BLK-Max hospital is world class. So you can compare with treatment with any other hospital of USA or Europe for that matter, and the cost will be maybe half or one third comparatively. So people are more attracted here.
Okay. So, for an Ethiopian patient, what should they know about the safety, standard, and quality of cancer treatments in India?
See, the people of Ethiopia should be made aware of the treatments available at India, the facilities and the cost of the treatment, and they should inquire with people there at Ethiopia who are dealing with management of cancer patients in India.
Mm.
So they should contact them, and maybe there may be some awareness camps or OPDs. Something should be organized there on a regular basis, so they can come across, meet people, they can gain confidence, and the facilities available at Indian hospitals should be known to the Ethiopian patients. So that's the way to go forward.
Okay, so and in your view, what aspects of Indian healthcare system build trust for international patients, especially from Ethiopia?
See, the most important part of the trust is that nowadays, when we treat cancer patients according to the international guidelines. The cancer patients are treated depending on the stage, the type of cancer, grade of the cancer, and the status of the patient, general status of the patient.
Okay.
So there are guidelines available. So if you follow the guidelines, that is the standard of care. So the interesting thing is that most of the Indian hospitals follow international guidelines. So when we follow international guidelines, we give international drugs. We have all the international facilities for surgery, chemotherapy, immunotherapy, target therapy, and since all the modalities are there and we follow the standard guidelines, and always we discuss cases in our tumor board, which consists of all the specialties like radiation oncologist, medical oncologist, surgical oncologist, pathologist, social worker, and so on. So when you treat patients as per guidelines and as standard protocol, then always you are going to give patient the best treatment, and that is available in India. That's the
Okay.
USP of our management.
Okay, great. So you have expertise in almost every major cancer specialty. How would you explain the importance of surgical oncology in the overall cancer treatment plan?
Yeah, I have been treating cancer by surgery for almost 28 years now. So I worked in all the big major hospitals of the city, that's the capital city of India, Delhi. And there has been, I have seen many patients, maybe thousands of patients, and treating many types of solid cancers. Now, see, the actual curative, the most curative way of treating all solid cancers means cancer arising from solid organs, not blood cancer.
Mhm.
Cancer arising origin from the, like, which are from solid organs like breast cancer or lung cancer, head and neck cancers or bone cancers. Their mainstay of treatment is only surgery. Chemotherapy, radiotherapy, immunotherapy are either adjuvant treatment or neoadjuvant treatment. They're supporting. But the mainstay of treatment is surgery. And as a cancer surgeon, I can see the when you do the surgery as per guidelines and adequate surgery for the patient and optimum
Mm.
surgery for the patient, that gives the best results.
Okay. So cancer surgery has advanced significantly. What are the biggest improvements you have seen since you began your career?
Yeah. See, cancer surgery has again seen lot of ups and downs, and there has been a lot of improvements over the years. Uh, More and more minimum invasive surgeries are coming into play in relation to cancer. Say, for example, if I tell earlier, we used to make big incisions in the abdomen or chest to open and do surgery. Now, many of our patients we are treating by doing using laparoscopy or by using robots. At the same time, our conservation of organs has is the mainstay of treatment now. When I started my career, most of the, say, breast cancer surgery, we used to remove breast, entire breast.
Oh.
But now most of our patients, we preserve breast, we conserve breast. At the same time, when I started my career as an oncosurgeon for bone tumors, say for example osteogenic sarcoma in children, 90% of the patient used to undergo amputation. They used to like sacrifice their limb. But now 90 to 95% of the cases of osteogenic sarcoma, we are preserving limb. And the patient after completion of the treatment can walk, can do cycling, can even
Mhm.
swim.
Mhm.
So that's the beauty. It has changed over a period of time. More and more minimum invasive surgery has come up, robotics have come up, organ conservation has come up, and at the same time, good anesthesia. Anesthesia has also evolved with time. So mortality of cancer surgeries has decreased quite a bit. Anesthesia is very safe nowadays.
Okay.
So, and critical care. Surgery is not merely by operating, it's not a carpentry. Surgery means after you finish the surgery, actual management comes after that. So, critical care following the surgery for the first 2 or 3 days in a major surgery is of very important. So, there is a lot of advancement in critical care, post operative care. So, as a whole, uh, this is the way how the surgery has evolved over the years.
Okay. When you perform a surgery, what factors decide whether the outcome is going to be long lasting and the successful surgery, or it's not going to be one?
There are many factors. I can't say there is not only one single factor. But the single most important factor is the stage of the disease. Earlier the stage, more chances of cure. Then patient's general status. A patient who is better built has a better prognosis. And the grade of the tumor, if the patient has high grade tumors, then chances of survival are less. If has a low grade tumor, chances of survival are more. And adequacy of the surgery. By that I means that if you have to remove not only the tumor, you have to remove some margins of the normal tissue around the tumor. At the same time, you have to remove surrounding lymph nodes and other organs as per the standard surgical plan. So many factors are there. The important factors I have already told you. So these are the
Okay.
factors which decides the outcome of surgery.
Okay. And which cancers most commonly require surgical intervention as part of the treatment?
uh, Almost all the organs, solid organs cancer. Our body is divided into two parts: solid parts and liquid part.
Hmm.
Liquid part is like blood and lymph. So from blood we have blood cancers like leukemia, multiple myelomas, and lymph we have lymphomas. Other than these liquid cancers, all the cancers are called solid cancers. And mainstay of treatment, as I told earlier, is surgery for all the solid cancer, be it head and neck cancer, or lung cancer, or breast cancer, or bone cancer, stomach cancer, colorectal cancer, gynecological cancers.
Okay.
Surgery is the mainstay of treatment.
Okay. So moving on, many patients fear major surgery. How is robotic surgery changing outcomes today?
Yeah, that's a very relevant question. See, by what advantage of robot we have to understand that first. There is more magnification. We can see all the small organ in a better view. We can have a three-dimensional view, and the maneuverability of the wrist. Like if I am operating with my wrist, then I can have this movement or this movement or this movement. But robot can have movement all around, which a
Mm.
wrist is not possible. At the same time, more magnification. You have got a better wrist movement of the robot than a human hand, and at the same time we can preserve many important nerves and important vessels. So if we preserve nerves, we preserve vessels, there is less bleeding, and if there is
Mm-hmm.
less bleeding, outcome is good. So as a whole, the robotics has changed the scenario of surgery, especially in like gynecological cancers or urological cancers.
Mm.
The robotics has led to less blood loss, less invasion, and quick recovery. The
Okay.
patient which we used to discharge after say 4 days or 5 days after surgery, those patients we can discharge the next day. So recovery is quick, and vision is exceptionally brilliant.
Oh, okay, great. So, what advantages does robotic and minimally invasive surgery provide to international patients who are concerned about pain, scarring, or recovery time?
See, as I told you, minimum invasive surgery or robotic surgery cause minimum pain and early discharge and quick recovery. If in terms of international patient who has come all the way thousands of kilometers he has traveled, so he has to come get the treatment quickly and go back to home quickly. So if you have got a surgery, big surgery done, and you get discharged early, you
Mm.
recover early, you go home early. So he has to stay for a smaller period, less pain, and so I think it's win-win situation for both doctors and patients.
Okay. Are there specific cancer types where robotic surgery provides a clear benefit?
Exactly. As I told you, robotic surgery provides clear benefit in urological cancer, especially prostate cancer,
Okay.
or you go for gynecological cancer like endometrial cancer, the cancer of the body of uterus.
Okay.
So definitely it has got advantage over the conservative way of operating them. And
Mm.
There are other surgeries like abdominal, upper abdominal surgery like stomach cancer or a colonic cancer. It definitely has more advantage in terms of recovery and outcome.
Okay. And how does minimally invasive surgery help shorten hospital stay and recovery, especially for those traveling from another country?
Uh, as I told you that since the pain is less, the dissection is less, blood loss is less, so the patient recovers quickly. So when he recovers quickly, he gets discharged quickly and goes home quickly.
Okay. So you oversee many specialized cancer programs at BLK Max. How does the multidisciplinary structure improve your ability to treat complex cases?
Yes, see, cancer management is not only surgery or not only chemotherapy. Cancer management is nowadays is multi-modality management. So it includes involvement of radiation, involvement of chemotherapy, involvement of surgery, involvement of hormone therapy, involvement of uh, immunotherapy, target therapy, etc. So we have got a team of doctors who is specialization in particular cancers, and we sit together in tumor board and we decide every case and we decide a comprehensive plan for treatment of that cancer on day one when we see the patient. And the
Okay.
day when it is decided that this is the primary treatment and this is the adjuvant treatment, and when all the modalities are synced together and they are operated and then they are given the therapies and all,
Mm.
so the results are best and the survival is the best.
Okay. So when multiple specialists work together under one roof, how does that benefit an international patient coming from Ethiopia or East Africa?
You get see when multiple specialists practicing in different modalities of treatment sit together, decide, gives opinion to the patient, so there is no question of bias. So everybody gives his independent opinion and we reach a consensus.
Okay.
That is number one. And number two, patient coming to a particular doctor and getting opinion from 4 or 5 doctors together, an opinion of the tumor board as we call it. So that gives the best confidence to the patient. See, this is the modality which is the best for me. If being say I am a surgeon, if the patient is not operable, if
Mm.
I say that patient is to be operated, my
Mm.
radiotherapy colleague will say no, it is not operable, radiation is better. Then medical oncologist will say that chemotherapy is better. Then we sit and discuss the literature, discuss the guidelines, what are the results all over the world. Then we come to a conclusion. So that is the way to treat a patient. That is the way to give the best possible treatment to the patient, and that's what we call it standard of care.
Oh, well, that's a lot of work. So, what makes BLK Max a strong choice for patients seeking advanced and coordinated cancer care?
See, BLK Max is a multi-specialty hospital having different centers of excellence inside one institution. Like that, we have Max Cancer Care Center, BLK Max Cancer Care Center. We
Mhm.
have comprehensive cancer care plan with us. We have all modalities of treatment available, all equipments available, all specialists are available, and at the same time, what I can assure you at BLK Max is the human touch. Treatment of the cancer involves a lot of emotions
Mm.
of the patient's relative. If you work like a machine and give the best treatment, but if you don't give emotional touch to the patient, the patient may not be happy. There may not be success. So the human touch of BLK and the quick support, the moment patient comes, it's a somebody takes care of the patient and takes the patient to various department for consultation, for investigations, and within a day or two all investigations are done, then the treatment is done quickly and at an affordable cost, and at the same time with a humanitarian touch. I think that's give us an extra edge over others.
Okay. So, many family delay treatment because of fear. What are the most common fears you hear from cancer patients nowadays?
Cancer patients has many fear. Number one, fear of death. Even if there are patients comes with very early stage, they have a fear of death,
Mm.
fear of biopsy. They said if biopsy is done, cancer will spread. They have
Mm.
fear of expenses. If I've got cancer, I have to spend entire savings of my life. And they have got fear of spread of the disease into their relatives. If I
Mm.
sit my husband, if I talk to my children, they will also have cancer. So these are certain myths and fears which patients have, and as a doctor, it's our duty to burn all these myths. And when a patient comes, we sit with them, give them time, and like try to pacify them and make
Okay.
them free of their fears.
Okay. So, cost is another concern. How can families think realistically about treatment expenses when comparing India with other countries?
Yeah, see, India is relatively cheaper in terms of expenses of cancer care if we compare with developed nations. So, having a world class treatment facilities and care, the cost are maybe half or one third.
Okay. So, some people fear the cancer surgery is extreme, like it is really extremely risky. So, what would you say to someone who believes this?
See, cancer surgery definitely are complex surgeries, so they are difficult to operate. But if someone who is expert and experienced in treating cancer and having experience of many years of doing cancer surgery, it is absolutely safe.
Mm.
So I can give examples of some complex surgery which I have performed over the years.
Yeah, please.
Say, for examples, we come across a lot of oral cancers because of tobacco consumption. So that surgery is called commando surgery. It takes around 10 to 12 hours, the entire surgery, but the results are very good. There are hardly any complications. At
Mm.
the same time, pancreatic cancer is a common cancer. Many patient comes, we do pancreatic or urinectomy, which is commonly known as Whipple surgery. Takes around 8 hours, 7 hours, 9 hours. So in expert hands, the complications are very, very minimum. At the
Mm.
same time, say bone cancer, osteogenic sarcoma, especially in children, the limb conservation surgery. So we have got a lot of implants available with us, and by doing chemotherapy, first we reduce the size of tumor, and then we conserve the limb. So
Okay.
these are very complex surgery, needs expertise which we have, and like for me, I have been doing all this surgery for so many years, around 28, 29 years. So our success rate is very good. We do all the complex surgeries, as I mentioned, like esophageal surgery, which
Mm.
involves surgery in the neck,
Mm.
chest, as well as abdomen. So
Okay.
the results are excellent. We have done many of such operations, maybe in terms of thousands. So surgeries are complicated, surgeries are complex, but in expert hands like our center, the chances of complications are very, very low, and results and outcomes are excellent.
Okay. And how safe is it for patients with cancer to travel from Ethiopia to India for their treatment of cancer?
If the patient is well preserved and he can walk, he can talk, he can travel, he can easily travel for treatment. And after treatment, we send patients when they are fit to fly. So
Fit
we,
to fly, okay.
yeah, when the patient's treatment is completed, we assess them in terms of their general health, like physical health, as well as investigations we do to see their well-being. And if they are fit, we allow them to go. And many patients are coming, hundreds of patients are coming, and they are getting treated and going successfully, happily home. So it's quite possible. There is no big issue in that.
Okay. So, for a patient in Ethiopia who is listening right now, what is the first step they should take if they want your opinion?
Uh, See, in Ethiopia, there are people who have their offices located in Ethiopia,
Hmm.
and they have contact with us, so they can contact them, and after contacting with them, they can arrange a meeting with us, like online consultation or video consultation. They can send us their query, their report by WhatsApp or other digital way. We study those reports, we give our reply, we reply the type of treatment, the success, chances of success, the expenses, the timeline, how much time he has to stay in India. They help them in getting their medical visa, they help
Okay.
them in getting hotel, they're moving about, their logistics, everything. So the care is like from womb to tomb. So they give all the support to the patient, right from their personal support to the medical support.
Hmm.
and the people are there, good people are there, and they arrange for all this. So you must contact them and take their help to get yourself treated. And the most important part of this is that all the people which I have seen who work in Ethiopia for medical tourism, the people are very humane.
Ah.
They just treat the patients who come from Ethiopia just like their family members. So I've seen, say, the people, say, Mr. Gaurav is there, one of the person who is into this profession. At the dead of night, he is with patients. He goes to airport to bring them, and they are so happy. Eats with them, patting their back. So you never feel that you are in another country or you are getting treated at a country which is far away from your home. So
Okay.
you feel at home.
Okay. Okay. So once someone shares their medical reports, what happens next? What's the step?
When someone shares reports with us, then we see the reports and then give and we write our opinion uh, about the treatment plan.
So this all
Sometimes
happens
there is
online.
need to do online consultation, video
Okay.
consultation. We do that also, and we
Mm-hmm.
satisfy them. We give them, if we need some more investigations which is possible to be done at Ethiopia, we ask them to do it then and there and send us the reports. We can sit again, so there is no issue. We can sit again and again and do video consultation. Sometimes we go also there to have
Uh-huh.
OPD, talk with them, meet with them, and so it's a continuous long process. And then patient comes, and when the by the time patient comes to us, we have all the information about the patient, and patient has all the information about us.
Oh,
So
great.
the bond and the strength of friendship is already there before the patient arrives.
Okay, okay, great. So when a patient arrives in India, how is their diagnosis confirmed and their treatment plan is created?
When the patient comes to us, many of the investigations have already been done back home. Some
Mm-hmm.
investigations which are not available there, or that investigations which we need extra, we immediately do the investigations. Then again, we take the patient to the tumor board. We discuss the plan and explain about the treatment plan to the patient, and then we
Okay,
start the treatment immediately. We don't ask them patient to wait. There is no waiting list for them.
okay. And after treatment, how is the follow up and care coordinated once they return back in their country?
That's a very important part of treatment actually. Follow up is done to look their well-being, about recurrences, about their side effects of treatment,
Okay,
and how they are faring up. So we like ask the patient to come routinely. Sometimes they send us report doing investigations there. Again, there are video consultations, and if needed, they we ask them to come to do some better investigations. So follow up is very stringent. We are in touch with all the patients which we have treated.
okay. Wow, that's great. So you have treated thousands of patients in your career. Could you share one or two stories of international patients who made a strong recovery?
See, I have treated thousands of patients, and there are thousands of stories. So many stories are there. So citing one or two story is just examples only. So say recently, one patient had come from Ethiopia. The patient had a big soft tissue sarcoma tumor in his back. So
Okay.
that was a very complex surgery. It was in very close to the axillary vessels.
Can you
Where,
throw some light on the sarcoma surgery?
that patient actually sent his pictures, his reports through Mr. Gaurav to us, and then we said them to send the biopsy report. They sent us biopsy report. It was soft tissue sarcoma, and it was a complex and difficult surgery
Mm.
to do. And doctors there has referred the case to us. Then when we asked the patient to come here, and his question was very simple: will you be able to remove this tumor? We had a consultation with them, and we said that yes, we'll definitely remove it and cure you. Then the patient came, we further investigated, confirmed the diagnosis and staging, and recently we have done surgery on him. We have removed the entire tumor with margins
Wow.
and with minimum blood loss, and we have conserved his limb, and he's absolutely fine, healthy, eating. He has been discharged from the hospital, still in India. He might be leaving India in a day or two. Very happy. This is one example. Similarly, another patient who came from Ethiopia only had ovarian cancer.
Mm-hmm.
And it's a very complex situation. The ovarian tumor was there. It was probably involving the adjacent structures and like rectum and ureters.
Okay.
But difficult surgery was there. We analyzed the scans thoroughly, called them here.
Mm.
We reviewed all the films and slides of the patient. We did further investigations and treated her. She's absolutely fine, a young lady. And the best part of this, she was unmarried, having ovarian cancer. She wanted to conserve her fertility. So we have treated her in such a way that she can conserve her fertility and she can marry and have child and
Mhm.
still
Wow.
treated with ovarian cancer. So these are some stories which give you confidence.
Mm.
Another boy, small, around 8 9 years old boy, came with osteogenic sarcoma, and everybody told there that he will need amputation. But somehow, with the grace of God, we could conserve his limb. We preserved his limb, so he's very happy. He's still writing letters to us. So there are stories which gives us confidence, which gives us solace. So I think that's the best part of our life, that we could help some people in our life.
Okay, so moving on. Personally, what moments remind you why you chose to be a surgical oncologist?
Yeah, that's a very personal question, actually. Uh, when I did my graduation in medicine, that is MBBS in Indian universities, I decided to be a surgeon first. Then I did my MS in general surgery. I became a general surgeon. At that time, I was thinking, what super specialty should I take? But unfortunately, at that time, one of my close relatives, my aunt, suffered from cancer, and she
Oh,
had to undergo complex surgeries and had a lot of complications. I had to take her to hospitals, many hospitals. I had a very bad time that time. That was my personal trauma, and that led me to decide that I'll do cancer surgery, super specialization, and I took this. That's actual fact.
okay, great. So, looking ahead, what new advancements in cancer treatment give you the most hope?
See, the many advancements are there, but when we talk of best hope, as we if we consider cancer, is the advent of new technologies in treatment,
Okay.
like in surgical, the invention of minimum invasive techniques, the robots, the good anesthesia which has evolved over the time, and in terms of chemotherapy, the invention of immunotherapy or target therapy, all these things is going has changed the entire sphere of the cancer care. So that gives us hope, and the biggest hope is the patient. Now more and more patients are getting aware of the cancer, so
Okay.
they're coming forward to get treated.
Okay. So, how do research, innovation, and technology influence your approach to surgery and the patient you're treating?
We have a department which is full of academics activity. We have got super specialty students who are doing postdoctoral courses. So we have
Okay.
to study and take their exams and take their classes. So whatever new advancements comes day to day basis, we have to be aware of that. So when all these latest techniques comes in the world, it comes to us. So that is how we get in touch with newer techniques, advances and all, and we catch it quickly and early
Hmm.
and implement in our practice.
Oh, wow. Okay. So, and in your view, what areas of global cancer treatment still need improvement?
The most important part which needs improvement, I feel, is the human touch.
Human
Yeah,
touch.
all the doctors may have lot of equipments, good surgeons, good cancer care, good hospitals, big hospitals, but many a times I see lack of human touch. I think that that's the most important part.
The
One should,
care,
yeah, care,
right?
and rather than
Hmm.
treatment, how to prevent cancer, that is very important.
Okay.
That is to be looked in, and how we can diagnose it in early screening. So screening of cancer, prevention of cancer, and adding human touch to the treatment, I think this is the area which needs more emphasis than the treatment proper.
Okay. Okay. So the next is a quick rapid fire round for you, Dr. Jain. So, one habit that can lower cancer risk.
Regular exercises and good diet.
Okay. One myth about cancer you wish people would stop believing.
Biopsy spreads cancer. This is the biggest myth.
Okay. One technology that changed the way you operate.
Robotics,
Okay. One value that every cancer surgeon must have.
human touch.
One moment in your career that you will always remember.
The moment in my career when I got my degree, super specialty degree, that is the moment which I never forget in my career.
Okay. So this is about a direct call in action now. Dr. Jain, for our listeners in Ethiopia who might be facing a cancer diagnosis and searching for options, what is your message to them?
My message to them is that number one, don't get afraid of cancer. Number two, contact some people in Ethiopia who are in touch with hospitals like us in Delhi.
Okay. And where can they send their medical reports for an extra expert review like you?
Yeah, they can meet the Miss Manju, as I told, and she can help them in sending the report to us and getting the reply, quick reply.
Okay. And finally, what would you like to say to someone who is delaying treatment due to the fear of uncertainty?
Irrespective of your stage, irrespective of your cancer, you should never delay treatment. The more you delay, the more chances of less survival. So never delay your treatment. Don't worry of cancer. Cancer is not visa to death. Cancer is not passport to that.
Mm.
Cancer is curable if it is detected early, and all the cancer at every stage is treatable. So today my message to all the listeners in Ethiopia is that don't worry for cancer. Cancer is treatable, most of the time curable. Get the
Mm.
best person to treat you and get it treated as early as possible.
Just a last question from my side. In your experience, which is the most complex surgery you've encountered?
Many complex surgeries which
Like just
anchor.
one case.
We do some surgery like esophagectomy or Whipple surgery, and then
Uh-huh.
complex head and neck basic skull surgeries, commando surgeries,
Hmm.
and all the reconstruction which we do following removal of the tumors. These are complex surgeries, and we swiftly do it.
Swiftly. Okay. Dr. Jain, thank you for sharing your expertise and experience. Your insights were incredibly valuable for our patients and families living across Africa who are seeking clarity and hope. To our listeners, early diagnosis and the right treatment can save lives. If you and your loved one needs cancer care, you can reach out to Dr. Pat or connect with BLK-Max Super Speciality Hospital to begin your treatment journey. Thank you for joining us on this episode. This is Tanishka from Dr. Pat, and we hope to see you again in the next conversation.